Question 1. A nurse is instruct an asthmatic patient how to use metered dose inhaler properly. Which should the nurse include in instruction? So, patient is diagnosed asthma, and the patient is acute exacerbation of chronic asthma. It is called asthmatic patient. So, and patient is prescribed to take metered dose inhaler properly. So, as a healthcare provider, what should be important instruction should be included? Answer: an interval of at least 1 minute should separate the first puff from the second puff. So if patient took the 2-puff inhaler, it is good to wait at least 1 minute. A patient is being discharged with a new prescription for an antihistamine. Which of these should the nurse include in the teaching plan? Answer is increase the drowsiness. So new prescription for antihistamine. Antihistamine has a side effect. They can cause dizziness, they can cause confusion, or increase the drowsiness. Next here, a patient with a severe allergic reaction is being transported to ER. The patient's vital signs are blood pressure is 140/90 millimeter of mercury. Heart rate is 100 per minute. Respiratory rate is 32 per minute. Oxygen saturation 89. Which of these should the nurse prepare to admit first? So in this clinical scenario, we can say vital sign, blood pressure is 140/90. It is almost normal or highly normal. Heart rate is 100 beat per minute, highly normal. Respiratory rate 32, little bit higher. Oxygen is 89, it is really less. And in that scenario, we give them oxygen. So epinephrine, because patient is allergic reaction, we give epinephrine, and also oxygen saturation is 89, so we give them oxygen. And next question here, a nurse is counseling a patient with asthma about the cause of albuterol and fluticasone. The patient questions the nurse about the purpose of Flovent inhaler. Which of these is the best response by the nurse? So if your patient take the fluticasone or Flovent inhaler, it is the steroid. So what we could tell, and which is the best response by the nurse? The Flovent is used to decrease the inflammation in your lungs. It is the steroid, and steroid we use as a prophylaxis. They reduce the inflammation. Question here, the nurse is educating a patient recently placed on triaminoprene regarding its common side effect. Which of these statements should the nurse include in the teaching? And medication may cause. So triaminophene can cause oral candidiasis, or also can cause pharyngeal irritation, right? So it is that strong medication that can easily cause fungal infection, candidiasis, or pharyngeal irritation. Next question, a patient has a history of allergy to peanut. The healthcare provider has recommended the patient take diphenhydramine, right? diphenhydramine is an antihistamine and patient is a allergic reaction. Antihistamine give. Which of this statement indicate that the patient understand the teaching plan? Answer, I should take these drugs as I experience the symptom. It is allergic symptoms, skin rash, itchy. So you give antihistamine. Antihistamine stop the secretion of histamine from mast cell. So teaching here, I should take these drugs as I experience the allergic reaction. And next question, a patient with asthma is being treated with cromolyn. It is bronchodilator. The patient asks the nurse how these drugs help with asthma attack. Which of these is the best response by the nurse? So here is the question, how cromolyn helps the asthma patient? Answer, this medication means cromolyn stabilize the inflammatory cell and prevent the release of histamine, because in asthma patient, too much secretion occur in the lungs gland and patient inflammatory change occur and respiratory pathway get narrow and shortness of breath develops. So if the medication can reduce the inflammation, reduce the mast cell release, histamine release, reduce, it is good for them. Question number 8, a patient taking the prednisone for chronic obstructive pulmonary disease, we call COPD. COPD patient treated by prednisolone, it is a steroid. The nurse should explain to the patient that frequent follow-up clinic visit will be necessary to assess for hyperglycemia and osteoporosis. This is the side effect of prednisolone. Prednisolone can increase the blood sugar level, we call hyperglycemia. So if our patient is a diabetic, you could educate them to adjust insulin level. Prednisolone also causes osteoporosis, bones erosion.